So we are uploading the answer of 5-star test 1, the best evidence-based neuropathologic finding in schizophrenia. Among the four options, enlargement of lateral ventricle is the best evidence of schizophrenia. Apart from that, among the options, it is not increase in cortical thickness, rather decrease in cortical thickness happens in schizophrenia. Jumping to the next question. This is a very ghastly appearance, and this particular disease is known as angiokeratoma. Angiokeratoma, where there is dilatation of dermal vessels and hyperkeratosis of epidermis, and this is known as angiokeratoma of Fordyce, which is generally seen in scrotum and vulva in women. There are 5 types. I'm telling in detail because this particular disease is pretty new, I'm sure, to many, and there are 5 types. First, solitary angiokeratoma, then angiokeratoma of Fordyce, then angiokeratoma of Mibelli, angiokeratoma circumscriptum, and angiokeratoma corporis diffusa. So these are the 5 types of angiokeratoma, and as per as treatment goes, it can be cured with surgery, cryotherapy, and also we can go for surgery, dissection, and electrodesiccation and scrape the spots off. We can also scrape the spots off. Among the given option, angiokeratoma is associated with, particularly angiokeratoma Fordyce is associated with Fabry disease. And that is why here we can, when it is associated with Fabry disease, we can give Fabrazine. That is the answer of this particular question. Now, myozyme and lumizyme are used in Pompe disease. Myozyme in early onset is for early onset Pompe. It is approved by FDA, and for late onset Pompe, it is approved by FDA. And eliglustat is par-oral given in Gaucher disease. After this, the next present question is, patient is experiencing breathlessness in upright position and fine in supine position. What of the following is most commonly associated with the above mentioned condition? So what is happening here? The patient is dyspneic when he is upright. So it is known as platypnea orthodexia syndrome. And it is happens in the condition which is having the pathology in heart, lungs and the liver. So it mostly happens in the hepatopulmonary syndrome, also in left atrial myxoma. It is Harrison 20 based MCQ. Now jumping to the next question. This particular finding, this whole life finding, is known as cornea verticillata. Cornea verticillata. So remember the mnemonics: cheap, a cheap fab, verticillata, a cheap fab. Fab stands for Fabry disease. So it is associated with Fabry disease in both the eyes. It is mainly associated with amiodarone, also chloroquine, hydrochloroquine, phenothiazine, and also indomethacin. So we have to remember it actually doesn't cause any visual difficulty. Apart from this appalling presentation, this whole like presentation, it doesn't cause any visual difficulty. And this is the pictorial question. Child presented with painless hepatomegaly and splenomegaly along with this histopathological finding have been given to you. This is a classical appearance of Gaucher disease, which is known as crinkle paper appearance. The question is, which of the types of Gaucher disease have shortest lifespan? So we have to know the types. Type 2 is acute neuropathic type. Type 3 is chronic neuropathic type, and type 1 have no neurological manifestation. So it is the most common, and here the survival time is almost the usual timing. Whereas it is most deadly in type 2. So answer is type 2, where the lifespan is less than 3 years. And chronic neuropathic type, actually the presentation is late and patient lives till 30 years. Hope you like this presentation. Hope you like the effort of giving you the extra point alongside giving the answers. And in case you like our presentation, let us know. how it is helping you. And if we get tremendous responses from your side, we will upload our answers within the 120 hours only. And if we are not, then we will consider that you are busy with your studies at this point of time. We are not going to bombard with your questions and let you study, and then after, from 2019 onwards, till the summer examinations, we are going to upload our questions and afterwards. Hope you like this particular presentation, and if you think this sort of presentation is going to aid you in your upcoming examinations, please be with us in the Facebook, Twitter and YouTube. Thank you for your support.